My name is Bert Duyon, and I will be performing a head-to-toe assessment on a patient. Well, a baby doll. So first, you assess the patient's chart for the right equipment, any medical needs, and any accommodations that you have to do. You provide privacy and have patient empty bladder and collect a urine specimen if needed. And then you introduce yourself, explain the procedure, get permission, perform hand hygiene, and then put on gloves if the patient has any breaks in the skin. So, my name is Bert Duyon. I'm your student nurse today, and I will be performing a head-to-toe assessment. Is that okay? And then first you will begin by getting the vital signs and ask if there are any pain, nausea, or discomfort. Once they say no or yes, then you move on to the head and neck assessment. So you check for a level of consciousness, orientation, and the orientation to the four spheres and speech. So you check for the pupils, for size, shape, and response to accommodations and light. And then you check the sclera, which is the white part of the eye, and the conjunctiva for color and moisture. And then you check the face for facial symmetry and skin color. And then you inspect the lips and the oral mucous membranes for color, moisture, lesions, anything like that. And then you inspect the neck veins for any distension. And then you assess dressing, tubes, or equipment in this area to ensure that it's giving proper function. Next, we will do the chest and abdomen. You first inspect, let's remove the baby's clothing. First, you will inspect the chest for the shape, ease of breathing, and correct muscle movements. Then you will pinch the skin for the skin turgor. And then you will auscultate the heart sounds for a full minute and listen to the rate, rhythm, and strength. And then after, you will auscultate the 5 lobes in the lungs, and you will listen anteriorly, posteriorly, and laterally. And then you inquire about any coughs, phlegm in the throat, or shortness of breath on exertion. And then after that, you inspect the abdomen shape. And then before you do any palpations, you want to inspect and auscultate because you don't want to interrupt anything or dislodge something. So you want to auscultate for bowel movements in all 4 quadrants. You start in the right lower quadrant first because that's where it's usually the most active, and then you go right upper, then you do left and right. And then after that, you will palpate the abdomen and inquire about any nausea or vomiting, last voiding, and bowel movement. And then after that, you will assess any tubes, dressing, equipment to make sure it's functioning properly, or make sure it's still in the right area. Finally, you move on to the extremities, and you palpate the radial pulses for strength and equality in both sides. And then you check hands for edema, warmth, capillary refill, and color of the nail beds. You will squeeze the nail bed and release. And then you will assess the range of motion in the arms. And then you will assess the hand grip on both sides. And then you will inspect any dressings, tubes, or equipment on the upper extremities to make sure they're functioning properly. And then you move on down to the lower extremities. And then you will palpate Um, you will assess for the color, uh, and then edema and temperature. So you will make sure it's okay. And then you palpate the pedal pulse for strength and equality. And then you assess range of motion and capillary refill time, strength and equity of plantar and dorsal flexion. So you would tell them to push against and push against. And then finally, you inspect any tubes, dressings, or equipment in the lower extremities to make sure they're functioning properly. And then you finally put the patient back in a comfortable position. You cover them up, tidy up the area, and put the call light in reach. After this, you let the patient ask any questions they may have, and then you perform hand hygiene, document findings in the chart, and then you compare and evaluate if the patient is improving, deteriorating, or staying the same.